Hi, everybody. Welcome here. We are so happy to have you. Uh, Welcome to this month's Luke's Legacy Family Research Rounds. This is a monthly session that is hosted both by Kids Brain Health Network as well as Can Child Center for Childhood Disability Research. And we are honored to have you all here today. This monthly session was actually inspired by the life of my son Luke, who unfortunately passed away a couple of years ago. But he was a disabled young man who felt like he deserved a seat at any table that he chose. And so we want to talk about partnership, about child development in his memory, because we want to make sure that every kid, every child, every youth has an opportunity to be able to make choices that work with them and to live full lives. And so we are very happy this evening to have Kelly with us, who will be talking about adaptive play amongst many other aspects. And I'm very excited to share this session with you this evening. This will also be recorded as well too, and added to our YouTube channel. So I will make sure that YouTube channel gets added to the chat as well too. So if you have a account, you can, as they say, like and subscribe as well too. So we're quite happy to have you here this evening. And I will pass the mic off to you, Kelly.
So much. Thanks so much, Ray. It's such a pleasure to be here today. I'm wondering, all those that registered, maybe at least I could speak on Ontario. They're outside because we have such beautiful weather, so they're gonna join. They're gonna subscribe afterwards. So, but those of you who were able to come today, thanks and appreciate it. So I'm just gonna share my slides if I can. There we go. 1 second. And can I just check to make sure it's just the slide that you see? Awesome. All right. So as Ray has mentioned, my name is Kelly Arbour-Nicitopoulos. I'm situated in the University of Toronto in Ontario, Canada, an associate professor there in the Faculty of Kinesiology and Physical Education. And throughout the talk today, I'll be mentioning another organization name called the Canadian Disability Participation Project, or the CDPP. And this is an initiative that I'm part of. There are about 40 other researchers, community partners across Canada. And this is a federally funded initiative focused on enhancing participation in exercise, sport, and play for persons with disabilities. And I also happen to be a mom, and you may hear my kids running around. So I think there's lots of parents in here, so you can appreciate that. So. All right, so I think it's important in terms of what are the goals for today. I hope you have fun and you learn something new first and foremost. But kind of three things I was hoping maybe take away from today's talk is first to learn a bit more about the research on physical activity in children with disabilities. Secondly, and I think maybe most importantly, there's some resources I want to share. They're completely free, so that's exciting, and they're focused on physical activity in children with disabilities. And whether or not this maybe it's more after the talk, the Q&A and beyond, to discuss ways to enhance the quality of physical activity in children with disabilities. And when I say children, the work that I'll be presenting today focuses on those ages 0 to 17, but I'm recognized, childhood, adolescence goes beyond upwards of 24 even, I think we see in terms of the World Health Organization. And physical activity can involve a lot of things. I'm really focusing in on sports, exercise, but also active play. So my talk today, I'm situated within two big problems, and within those big problems, there's many other problems, but two big problems in the area of physical activity in children with disabilities, and some solutions to those problems. But I thought in terms of to ground this talk, and many of you think on the call are likely aware of in terms of the fundamental rights we have in the United Nations Convention of the Rights of the Child to play. We also have the United Nations Convention of the Rights of Persons with Disabilities in terms of participation. But we often see that this fundamental right, while it's stated as such, I think the way that in terms of physical activity, spaces, often exclude individuals, particularly those who experience disability. So I think the first problem I really want to highlight in my talk today is that the rights of Canadian children with disabilities to fully access and participate in physical activity is being denied. within the literature on physical activity and disability, there's really a strong body of evidence that identifies many individual as well as environmental barriers that factors that influence the participation of persons with disabilities. So children, youth, as well as adults. At the individual level, so I've situated, or I have a diagram there that takes this, what's called a social ecological framework. Some of you may be familiar with this. So at the center is the individual. And so we look at in terms of individual level behaviors or barriers, maybe age, gender, impairment level, functioning, etc. Then we go kind of outwards where we see in terms of the research, there's the interpersonal level. So the support system around the individual, parents, teachers, and coaches. Then even broader than that, at the institutional level, rehabilitation centers kind of situating it there, schools, sport clubs, and even beyond more that community, neighborhood, and policy. So at every one of these levels, there's evidence to suggest that there are these barriers to physical activity for children with disabilities that really deny that right and make it more of kind of a privilege to be involved in physical activity. So in terms of a recommendation around how to address this problem is, as a society, we need to consider the access to community spaces, programs, and services, not only from a quantitative standpoint, so whether or not, a park exists somewhere, someone lives close to a school, but the quality of those spaces and do they provide a quality experience. So quality participation, where I'm focusing it on, it comes from research that I've been involved in the Canadian Disability Participation Project, where we define quality participation being achieved when an individual with a disability use their involvement in physical activity as satisfying and enjoyable, and they experience outcomes that they consider to be important. So it's very much a personal experience. This concept of quality participation really is built from a framework that focuses in, I have it on the slide here, around quality experiences. This research stems from a lot of research in the area of parasport, so physical activity research in persons with physical disabilities in sport. And the figure there really shows the core ingredients of quality participation in physical activity for persons with disabilities. So the model is based on rigorous and a systematic research process that did involve the disability community. So there were interviews and consensus panels and with athletes, particularly athletes with disabilities, caregivers, coaches. And it illustrates in this framework that a quality physical activity experience is made up of one or more of what's called building blocks. So I'm not sure if you see my cursor here, but these building blocks that relate to having a sense of autonomy or choice in what one does, a sense of belongingness, feeling that acceptance and related with others, challenge, so feeling appropriately tested, engagement, so being focused and in the moment, mastery, it's a sense of achievement, and meaning. And this is both a social and a personal valued outcome. And I think what's really important to note within this framework is that it's not just a one-time thing, that this quality participation is built up of repeated exposures to these quality experiences. You don't have to hit all six, but it's, having these at least one, if not more, of these building blocks being targeted, for example, in a sports program. And equally as important within this framework is that these quality experiences are supported by a proper foundation of having a safe, welcoming, and inclusive environment. Now, this research that we have done within this Canadian Disability Participation Project, a lot of the work's focused on quality participation in sports. And here's this, as I start sharing resources, there's 3 resources. If you click on the QR code, if you can do so, and I also can send Ray and Kinga, the links afterwards, if those who don't maybe can access the QR code, where as a team we've created with community partners, so Special Olympics, for example, being one of them, to create these what are called blueprints for building quality participation sports for children with a disability. Now, when we think of physical activity, we often think of sport, but there's more to life than sport. And, at least I tell that to my brother, who's a big sport fan. Um, and one of the, I think, the best things for children as in terms of just play. And when we think of play, maybe some of you may go to playgrounds. And so a lot of the work that I've been focusing in the past 4 years is applying this aspect of quality participation specific to playgrounds. So this particular project that I've been leading, it's focused on in Canada. We have a children's charity called the Canadian Tire Jumpstart Charities. So Canadian Tire had committed back in 2018, if I have my dates correct, $50 million Canadian over a 5-year period to support children with disabilities in physical activity. So some of this support, for example, comes at the individual level where, registration in a program or equipment. But as part of this commitment, they had what's called this inclusive play initiative. And they kept committed that they would build at least one accessible and inclusive playground in each of the 10 provinces and 3 territories in Canada over by 2023. And so I got wind of this amazing kind of initiative. And as a researcher, I asked them, is there a researcher evaluating this? So they said, no, you're interested, like share a proposal. So I'm really fortunate to be involved in a very multidisciplinary team where we have individuals in terms of urban design, exercise and sports psychology, childhood disability, and programming, where we are looking at the Jumpstart playgrounds as one example of a possible, not only accessible but inclusive playground, looking at the experience of the communities that are basically gifted these 1 million or more, I think now in terms of inflation, playgrounds. And just to give you a sense of the size of these playgrounds, so they are anywhere between 7,500 square feet to upwards of 20,000 square feet. They're massive. Calgary has one, right? Edmonton has one, Toronto has one, and so other provinces and territories. The only territories that does not have it is Nunavut, and the permafrost has been a challenge. So, but the images you see on your the slide there are taken from the playground. So it has a double wide ramping, in access from one point to another. So you're not just stuck and have to go back the same when you came in. You can, individuals who use some mobility devices cannot only just be on the surfacing, which is rubberized, not wood chip or sand, but also they can access the elevated spaces. And, there is some assistance required in terms of from a caregiver to support, let's say, a child out of a wheelchair into a slide, but accessing the elevated spaces. So there's lots of really interesting features, and I'm happy to share more in terms of the design. I had nothing to do with the design. As a researcher, we really wanted to go in and say, let's learn about experiences. So the playground research that I've been leading is we've been really focusing on 3 areas. So first, around informing playground design. So most of the playgrounds that, if you're a parent, you may spend a lot of time in the playgrounds. Maybe just a child, you spend a lot of time in the playgrounds. Wood chips, borders, like inaccessibility galore. So these playgrounds that are now being built, inclusive playgrounds, and accessible playgrounds, to me, those are 2 different things. And we could have lots of conversations afterward about that. But, we're looking at how to inform playground designs to make spaces more accessible and ideally more inclusive, particularly in terms of disability. Secondly, we're focused on understanding experiences with playgrounds, those jumpstarts being those playgrounds of interest rate for this particular project that are designed for disability inclusion. And thinking of the adage of, if you build it, will they come? Well, often no. You need to do more than just have it there. So what can be done? How can we really maximize the use of these spaces? So creating opportunities for quality playground participation. So I'm going to focus on these 3 areas really quickly and just showing or sharing resources based on research that we've done. So in terms of informing playground design, this work has really stemmed from lots of different reviews that we've conducted. And so on the left-hand side of the slide is findings from a scoping review, which is published, But we thought, let's be more playful and work with a graphic designer, Megan Chung is her name. And can you take these 13 recommendations around inclusive playground design that we've found through a very systematic process in the review and make it fun and share this information? So Megan took those 13 recommendations and applied them to this image here. So again, if you go on that QR code, you'll see more information about our review, but those 13 recommendations about what makes a playground an inclusive playground and how to design it. So it's great to have recommendations, but then there's the how to actually enact those recommendations. So on the right-hand side is what's called our inclusive playground playbook. So this was spearheaded by myself and my colleague Tim Ross, who's at Holland Bloorview Kids Rehabilitation Hospital, which I'm sure many of you are aware of, located in Toronto. And what we did here was we took information, kind of what we say the gray literature. So not just published studies, but also we looked at reports. We looked at some guidelines that not just in Canada, but across most of the continents. We looked, I think, about 5 of the continents. We spoke with designers. And from there, we created this playbook where it had these 4 sections. We borrowed from some other work happened to be in Australia. I know there's a couple of people joining Australia, but I think I really loved in terms of the way it was set out. So the first part of the playbook goes, how do we start? So if we want to develop an inclusive playground, how do we get started? So going into community engagement, talking about where to, in terms of find like the site, location, funding. Then it goes into can I get there? So once you think about creating this playground, how can you get there? So things around messaging, website design, and that's working with parks and recreation associations, making sure that this information is available, readily available and accessible. Then can I play? So that goes into what are recommendations in terms of the equipment on the playground, sometimes around programming, because that is actually linked with our evidence-based recommendations around programming possibilities to take off some burden, caregiver burden, just giving some respite on the playground. And then can I stay? I think really what's come out a lot from this work as other playground work is it's not just the playground itself. It could be the most accessible, inclusive playground, but if you can't, there's a surrounding environment that allows you to get there. Like they don't have the accessible parking, you need to use a washroom. Then that whole visit becomes not a great visit. So we have things around maintenance and how to make use of the surrounding environment. So it's a really great resource, and I highly recommend, especially if those of you who are interested in kind of advocating for more inclusive playgrounds in your communities. We got a playbook for that. So use our QR code. All right, in terms of the another part, in terms of looking at experiences within these inclusive playground, these playgrounds designed to be inclusive. This research that we've done, a lot of it happened pre-COVID, so 2019, where we were able to go to 4 different locations. I've noted there on the slide those locations of the playgrounds that were built at the time, and do some interviews with children. Oftentimes it was maybe siblings of the child with disability, a few children with disability who were able to take part in the interviews, lots of parents, as well as professionals, so rehabilitation professionals and teachers. And so we just had done interviews. We were on the playground, we hung out, we talked to kids, we talked to families, learning about their experience. And I would say that for the most part, they're really excited to have this space. I mean, it was time some people said the thanking jumpstart, but interesting, right? Why, it should be there, but like that's a kind of an interesting observation. But one thing I wanted to highlight that came out, and I think just some of the parents that may be on joining us today, is that this hidden labor parents spoke of. So for some parents that we spoke with, and particularly parents of a child with disability, they felt that this was a great space where they loved having questions, for example, about their child. This may be the first space that a child who doesn't have a disability may interact with a child who does have a disability. So in this one quote here, and I want to make sure that it's known that the name Lucy is a fictitious name, it's not the real name. where Lucy says, "We get a lot of questions about my son in the wheelchair, but I don't mind answering. I think it's good. And the reason that a lot of kids ask questions is because they don't typically see kids in a wheelchair. Why don't they see kids in a wheelchair? Because there aren't places like this and to encourage them to come. I love the fact that we do get these questions. It builds that level of education in society. So for Lucy, expressed here, these questions were very well received and having, that educator type of role. But it wasn't always the case. There are some parents, again, of children with disability. Sandy, again, fictitious name, said, the majority of time, don't get me wrong, when I get approached by families or kids, it's not done maliciously. They are curious or saying, don't play with her because maybe they don't want to ruffle my feathers or my daughter's feathers. And I get it. But in the end, it also hurts my feelings and my daughter's feelings because she still doesn't have anyone to play with. But it's still not always my job to play with her like this, or say you can hold her hand like this, or you can talk to her like this. This is how her iPad works. No, I'm not a teacher every day, right? So I really brought out these two quotes to really illustrate, these spaces may be accessible, but are they inclusive? What makes that space inclusive? And I think this really highlights the need in terms of the education, and it's not the job of a parent with a child with disability to educate the rest of the world. It's parents to have conversations with their children, and what does it mean to be inclusive? And recognizing this really um, facilitated our group to think more about how do we foster quality participation on playgrounds to take it from that accessibility piece to be more inclusive. And where we've really landed right now in terms of some of these resources, again using the research that we've been collecting through the interviews, is play leaders being one. So this is a screen. This screen here shows you. It's a training series that Jumpstart has. It's called our Coaching Kids of All Abilities training series. And so we partnered with them to add to this training series a module called the Inclusive Play Leadership Certificate, where anyone can register, but it's really targeted to, we call them play leaders, but like you could think camp counselors or future camp counselors, recreation leaders, coaches, even sport coaches, and taking them down back to the basics of what do we mean by inclusive play? What are the fundamentals of inclusive play and talking about quality participation? And how do you support inclusive play? And we take that playground as one example of such. So there is a nominal fee. I think it's about $15, but this has been really well received. Several of the municipalities who have the playground of an added tool, but also could be, they have required training for their camp staff. This may be something, it's an hour and a half at most, that they can tack on to the training that must be done. To complement this, we also have done a blueprint. So I said we had the sport blueprints. We now have a blueprint to support quality participation on playgrounds, and it's targeting programmers. We've taken those interviews with parents, children, and the professionals, and did some coding to see in terms of strategies to support one or more of those building blocks. So that blueprint is available, and we are just in the midst of finishing up a caregiver blueprint. And again, this is not just parents or caregivers of children with disabilities. This is for all caregivers to think about in terms of how to be having those conversations with their children, supporting play, inclusive play on playgrounds specifically. So I mentioned there's two problems. So I mean, problem one could probably be, again, I have probably 3 hours really to talk more about, but like to just kind of focus a little bit different, but still related, is problem number two. So currently, and despite global calls for action, Canada is lacking population level data on the physical activity of children with disabilities. So this is an issue. Now, policymakers in Canada, where do they go to? They look to this having reliable, valid data to make decisions, for example, on services and policies. And so without having that good data, that really means policymakers may have to look elsewhere. So why does this matter? Well, with World Health Organization, they have what's called the Global Action Plan on Physical Activity, or GAPA. And they have within there stating the importance of a national evidence-based data systems to create what are called active systems, both at a national level and also international level. And specifically, that's noted within their GAPA report is that the need to have national evidence data systems to support population level surveillance of physical activity and to prioritize an efforts to address disparities and reduce inequities. So these evidence data systems and surveillance are essential to be able to achieve this World Health Organization's goal of reducing physical inactivity globally by 15% by the year 2030. So as I mentioned, Canada, we don't currently have really strong national level data. What we do have and we're part of, and other countries are part of this as well, in terms of physical activity surveillance and reporting in children and adolescents or youth, it's what's called the Global Matrix. So this started back in 2014, and Canada was a leader in this. And it's now, the oversight is through Active Healthy Kids, the Global Alliance. And what the Global Matrix is that it's countries that sign on to commit to following a harmonized process and grading of different what are called indicators. So you can think of indicators like subjects. You have your report card, you different, arts and math and that sort of thing. So they have indicators, for example, overall physical activity being an indicator for schools. And then in each country or jurisdiction, they're to get national level data for each of these indicators based on certain benchmarks. So these then form the report cards, which are released biannually. And these report cards are really critical because this is the information that then can be shared, let's say at the government level, to say, hey, what do we need to put in terms of funding? Well, this indicator's low, so let's fund, that in terms of schools, let's say. Some of you may be more familiar than others, but in Canada, we have what's called participation that really spearheads the release of the biannual report card. So I know here are grades that we typically have seen since 2015 for each of the indicators. The ones that are in black are what are the 10 common global matrix indicators. And then the ones in red are very Canadian specific. Physical literacy, for example, that's not something that all countries have to report, but in Canada, we do report that in a report card. When you look at the grades, they're not wrong. They don't look so great. So we tend to see very low grades, Ds, for example, in overall physical activity, better grades in terms of organized sports, but I'll say that's does your child participate in sport or not? It doesn't really talk about their quality experience in that. But then we see the grades in terms of where they're better is what we'd say those influences like family and peers. We see, C pluses, schools, we see Bs, and government, we see probably one of the best grades. So that's quite interesting in terms of that. So for that problem, a recommendation that I would have is to really invest in national physical activity monitoring to evaluate progress towards reducing participation disparities in children with disabilities. We need better data in terms of physical activity levels for children with disabilities to be able to have a better sense. What we have right now is a report card based on children and youth without disabilities. And is that really fitting in terms of children with disabilities? So to kind of address this, recommendation, I've been fortunate to work with a really large team in Canada where we do have a national physical activity, what's called measurement study, again, funded by Jumpstart, which is interesting, not at the federal level, Jumpstart, as part of that initiative I spoke earlier in terms of inclusive play. But since 2018, we have been collecting data on physical activity levels, as well as screen time and sleep, which the three of them together are known as what's movement behaviors in children with disabilities across Canada. We finished data collection and then this spring, where we had about 550 parents do throughout that time period complete surveys, 80 interviews and surveys with children, and we also had them wear Fitbits. So we had just about 150 of them wear Fitbits. So what I really wanted to quickly show from these MPAM study we call is just in terms of what we see with the parent data with the percentage of children with disability in our sample that are meeting guidelines, because that ends up being the focus of these report cards are these guidelines. but a little bit of a caveat in terms of the guidelines. I have on the screen the Canadian 24-hour movement guidelines for children and youth. These are pretty much mirror the World Health Organization guidelines for children and adolescents. So we have the four kind of, or I would say more three movement behaviors. So physical activities broken down into sweat, so moderate to vigorous physical activity. So children and youth ages 5 to 17 are recommended on average to participate in at least 60 minutes or more per day of sweat-based activities. In terms of sit, which is really focused on screen time, it's no more than 2 hours a day. And then sleep is anywhere from 8 to 10 hours a day, depending on the age of the child. A huge disclaimer is that the evidence that was used to inform these guidelines did not include children with disabilities. So while I'm showing you in the next slide in terms of, we'd say, adherence levels to these guidelines, I'm also not saying that we don't have enough evidence to say these are the exact guidelines that children with disabilities should be following. So we look at with this MPAM data set that we have, and again, based on parent report, about 555 parents to be exact, I guess. In terms of that sweat guideline, 1.5% of the sample were meeting the sweat guideline, that moderate to vigorous physical activity, 60 minutes a day. Screen time, we see higher percentages, 20% in terms, and then sleep, pretty high, 93%. Quantity of sleep, not quality. That's important. Again, the quality piece is so important. This is very much from a quantity standpoint. When we take all three of these behaviors, we take these meeting the percent meeting the three movement behaviors, we have 0.4%. And really it's the physical activity that's driving this, as you saw in terms of those adherence rates. Now, again, I'm not necessarily a big fan of guidelines, to be honest. There's a lot more work that needs to be done, but these seem to be kind of the gold standard when we look at report cards. And kind of revisiting the report card issue, I am quite proud of this work to share to you today is that we had a team in Canada, and there was other teams, I think in 13 other countries, where we were part of this initiative, what's called the PARA report cards. So these PARA report cards are supposed to be parallel to the larger report cards that are put out every 2 years for children and youth without disabilities. And in Canada, we did a process where we involved researchers as well as knowledge users. Specifically, we had parents on our panel, community service providers, disability advisor committees, and people with expertise in the global matrix process and national surveillance, where we had used data sets like the MPAM and some other national data sets to see where we're at in terms of, in Canada, with regards to what indicators do we have data for, and when we use the benchmarks that are put forward by the global matrix, where do things stand in terms of physical activity levels and sources of support, et cetera, for children with disabilities. So this slide shows, again, our Canadian report card. There are 13 other PARA report cards, and I can share that information. Maybe I could circulate that if people are interested from other countries. So the left-hand side shows grades based on the indicators. Where we're seeing is a similar pattern with regards to the larger Canadian report card, where grades are lower in our individual behavior. So overall physical activity getting a D, active play getting an F, organized sport getting a C+. But we are seeing lower grades in those other kind of sources of support versus what we see in the larger report card. What I find to be most telling is that almost half of the indicators we had graded incomplete because we didn't have enough data. Further stressing the need for more national data in Canada and elsewhere for children with disabilities. So there's a lot more that I could share today, but I'm going to finish off in terms of some future thoughts and directions, and maybe to that point, love to get some questions and discussion going, if that's okay, Kinga and Ray. So future directions, I kind of boiled this down into 3 areas. Opportunity, thinking about the need for more intentional and funding and resources going into accessible, inclusive design. I really think kudos to Jumpstart in terms of their initiative, but it's not, there are other groups that are also doing some great work in terms of inclusive and accessible playgrounds. But playgrounds aren't the only thing, right? We need to see how, I think COVID even really made it stronger. Parents on the line here, you always knew it, but I think COVID really, like, we were told to go outside, and like outside is not accessible. So we really need to do more in terms of we being society, government, researchers, etc., around that. I put physical activity messaging also as part of an opportunity. A really good colleague, Rebecca Bassett-Gunter, out at York University in Ontario, and she does a lot of work in terms of messaging. And so again, if you build it, will they come? So how do we get the information out, particularly to families, that there is something that exists? What, the language to use. So that's, to me, is another area of further work. And disability inclusion training. The quality of participation really often boils down to coaches, teachers, recreation providers. So we need that, there needs to be more, not just training, but we need to have evidence to support the type of training that needs to happen. In terms of participation, I I said to you how much I didn't really like the guidelines. I really think we need to do more, and I think there is work that's really pushing this. My good colleague and mentor, Kathleen Martin Guinness, has done a ton of work in spinal cord injury, but around physical activity guidelines, but customized physical activity guidelines for children with disabilities is a huge need. Outdoor and risky play, I find this fascinating. There's stress of kids need to be outdoors, kids need to be risky in their play. Well, what does that mean in terms of children with disabilities? Risky play doesn't just mean physical. There's a social part to it. So that's an avenue for further research. Building off of the work around quality participation, how do we build quality participation at home, at school, and beyond? And in terms of engagement, this is something that I am really excited to do. King and I are doing some work as the larger team, some funding that recently happened. But I would say, I know Can Child and other groups do such great work in terms of family engagement research. Not a lot of it's happening in terms of physical activity. And well, I'm one of many who want to change that, but family engagement research really needs to happen more in this space. Focusing on parent co-participation. Parents also need to be active. We're tired. How can what are ways participate, how we can participate with our children, that we both, both can be a win-win situation. And then really the research, how do we then get it to policy? Great that, we have this in terms of academia, articles, but like, how do we actually make a change, make a difference, getting to policy changes at school, at sport, and in recreation? So there's just some thoughts. I have at this slide my email, Twitter, whatever it's called now, X, I don't know. But I'll stop there.